In the heart of New York, a story unfolds that blurs the line between healer and harm, between compassion and catastrophe. Dr. Michael Belfiore, an osteopath, stands at the center of a storm that has left lives shattered and a community questioning the very essence of medical trust. To some, he was a compassionate healer, a man who believed in fixing people, in alleviating their pain. To others, he was a reckless professional, a Dr. Death, who prescribed deadly drugs with abandon. The question looms large. Who is the real doctor, Belfiore? And how did a man sworn to do no harm become the face of one of the most shocking medical scandals in recent memory? Before we get started, make sure to subscribe and turn on notifications for in-depth coverage of true crime, unsolved mysteries, and the dark side of history. The rise of Dr. Belfiore, a healer's promise. Dr. Michael Belfiore was not always a figure of controversy. To his patients, he was a beacon of hope, a man who promised relief from the relentless grip of chronic pain. His practice was bustling, with 30 to 50 patients a day, each seeking solace from their suffering. Belfiore's approach was straightforward. He believed in treating pain aggressively, often prescribing powerful opioids like oxycodone to manage his patients' conditions. In his own words, "Every prescription that I wrote was for a legitimate medical purpose." He saw himself as a fixer, a healer, a man who could make the unbearable bearable. But as the years passed, the line between healing and harm began to blur. Belfiore's prescriptions piled up, 5,000 in just 3.5 years, totaling a staggering 600,000 pain pills. His practice became a revolving door for patients seeking not just relief, but a steady supply of highly addictive opioids. And then, the unthinkable happened. 2 of his patients died from overdoses, their lives cut short by the very drugs meant to heal them. The fall from healer to Dr. Death. The legal system caught up with Dr. Belfiore after a series of complaints from pharmacies led to an undercover DEA investigation. The allegations were damning. Belfiore was accused of illegally prescribing drugs to addicts who would then sell the pills on the black market. The DEA's case was bolstered by a confidential informant who claimed that Belfiore knowingly prescribed opioids to individuals with no legitimate medical need. One of the most tragic cases involved John Eubanks. Eubanks turned to Belfiore for help, and the doctor prescribed increasing doses of oxycodone, along with anxiety medications and muscle relaxers. Over the course of 17 months, Eubanks received nearly 3,000 pills. According to Belfiore, Eubanks' pain was well under control. But the Marine's life spiraled out of control, culminating in his death from acute mixed drug intoxication. Prosecutors argued that Belfiore ignored at least 40 red flags, indicating that Eubanks might have been abusing his medications. Lab tests revealed the presence of THC and Xanax in Eubanks' system, neither of which had been prescribed by Belfiore. There were also signs that Eubanks was sharing or selling his pills, as he frequently claimed his medication had been stolen or lost. The undercover sting, a doctor's downfall. The DEA's investigation took a dramatic turn when an undercover agent posed as a patient seeking painkillers. In a series of visits, the agent faked back pain and walked out with prescriptions for 540 pills, paying in cold, hard cash. The undercover footage was damning, showing Belfiore prescribing powerful opioids with little more than a cursory examination. Prosecutors argued that Belfiore's actions were not just reckless, they were lethal. But Belfiore's attorney pushed back, claiming the undercover video was misleading. "It just represents an office visit, that's all," he argued. He also pointed the finger at pharmaceutical companies like Purdue, accusing them of misleading doctors about the dangers of opioids. "I think he's being scapegoated," the attorney said. "It's a total misapplication of the law." The trial, a battle for justice. The trial of Dr. Michael Belfiore was a media sensation, drawing national attention to the opioid crisis and the role of doctors in fueling it. Prosecutors laid out their case with precision, painting Belfiore as a drug dealer in a white coat. They argued that his medical practice was not just reckless, it was deadly. Belfiore, they claimed, had ignored clear signs of addiction and abuse, prioritizing profit over patient safety. Belfiore's defense team fought back, arguing that the deaths of Eubanks and another patient, Edward Martin, could not be directly linked to the doctor's prescriptions. In Martin's case, the autopsy report stated that he died from an overdose of oxycodone, but the prescription bottle found on his body was for OxyContin, a drug Belfiore claimed he never prescribed. "Prove it," Belfiore challenged. "They have to show that I had an evil mind." But the evidence was overwhelming. Prosecutors presented testimony from pharmacists, patients, and medical experts, all of whom painted a picture of a doctor who had lost his way. Belfiore was offered a plea deal, but he rejected it, insisting on his innocence. After a 5-week trial, the jury delivered its verdict. Dr. Michael Belfiore was guilty of illegally distributing oxycodone and causing the deaths of John Eubanks and Edward Martin. The judge sentenced him to 23 years in prison and ordered him to pay $17,000 in restitution. "It's a gross abuse of power, responsibility, and trust," the judge declared. For Belfiore, the verdict was a devastating blow. The man who had once seen himself as a compassionate healer was now a convicted felon, his legacy forever tarnished by the lives lost under his care. But the case also raised larger questions about the opioid crisis and the role of doctors in perpetuating it. Were doctors like Belfiore simply scapegoats, as his attorney claimed? Or were they willing participants in a system that prioritized profit over patient safety? The case of Dr. Michael Belfiore is a cautionary tale, a stark reminder of the dangers of unchecked power and the devastating consequences of the opioid crisis. It's a story that forces us to confront uncomfortable truths about the medical profession, the pharmaceutical industry, and the societal factors that drive addiction. As Belfiore begins his 23-year sentence, the debate rages on. Was he a compassionate healer who lost his way, or a reckless pill pusher who prioritized profit over people? The answer, perhaps, lies somewhere in between. But one thing is clear: the fallout from his actions will be felt for years to come, a grim reminder of the cost of greed, negligence, and the abuse of trust. In the end, the story of Dr. Michael Belfiore is not just about one man's fall from grace. It's about a system in crisis, a society grappling with the devastating consequences of addiction and the urgent need for change. As we reflect on this tragic chapter, we must ask ourselves, how many more lives will be lost before we take meaningful action to address the root causes of the opioid epidemic? And how many more doctors will cross the line from healer to harm before we hold them accountable? The answers to these questions will shape the future of medicine, addiction treatment, and public health. But for now, the story of Dr. Michael Belfiore serves as a sobering reminder of the stakes and the urgent need for reform. If you enjoyed this video, please make sure to subscribe to our channel and hit the bell icon to never miss an update. Until next time.